Hi everyone, joining us in the Toyota Solutions studio is Dr. Fozia Alvi. Dr. Alvi is a family physician in Calgary, Canada, but recently decided to head to the refugee camps in Bangladesh that are housing some of the hundreds of thousands of Rohingya refugees that are fleeing Myanmar in the face of what international organizations have called a genocide. Frankly. Dr. Alvi, thank you so much for joining us.
Thanks
I do want to
get
to solutions and what you see as being ways out of this. But let's start by, why did you go?
First of all, thanks for having me. It's lovely to be here. So, of course, first of all, there's a human element to it, because I was hearing, stories of massacres, rape, violence, and as a human being, as a mother, as a doctor, it was hard. And I heard about Myanmar back in about 2015 when my husband went as a volunteer to distribute food rations to those people who are inside the concentration camps inside Myanmar.
Okay.
So when he came back, he told me horrible stories that, how those people were living. They were facing the forced starvation, rampant diseases. He was so disturbed, he couldn't eat for days after coming back.
Wow.
And he was telling me that he was passing food to mothers who were literally skin and bone, and they were passing to their children first because they were starving. Yeah. So it was just like horrifying. So that was my first introduction. And then last year I heard that there are lots and lots of sick patients and lots of pregnant women and only literally a handful of doctors. So then I decided as a physician I must help.
Okay, so you arrive at the camps, and what is your first impression of what you see?
So there were children everywhere. There were almost more than 50% of the refugees are children under the age of 16. And about 40,000 are orphan children. They don't know where their parents are. Some of them have seen their parents being cut in front of them. So as a mother, I was unprepared to see such large number of unaccompanied children. And then in the medical camps, I saw like lots of people with different diseases that sometimes they're not common in our world, like polio, diphtheria, because we have good vaccines against them.
Diseases that have been eradicated.
Eradicated, right. So I saw lots of them because these Rohingya people, they did not have any access to medical care back in Myanmar.
Okay.
So those people are still suffering from it. And then I saw people, lots of people with severe malnutrition, literally skin and bone. Those were babies who were starving because their mothers didn't have the breast milk to feed them. There was adults with severe muscle wasting. All these are signs of long-standing starvation. And there were lots of people with diarrhea, cholera, because the lack of proper clean drinking water and lack of proper sanitation.
It just sounds like hell on earth, frankly, the way you describe it.
That's right.
So you go in as a physician. First of all, is there food and clean water and the basic provisions so that these people can start to be nourished?
So when I went there, there was like one, we call it shallow well, hand pump, the mechanical hand pump. There was one pump for 3,000 people. And you can imagine, for those people who are already, came back tired, starving, how they're going to get so, and there was not proper washrooms. So the wells mostly at that time were shallow, so there was contamination between the water wells as well as the the toilets. And those people were again coming back and forth, with lots of parasites infection, GI infections. And back then, when the plight started last year in August, so we went there in October, most of the people were getting food, but only maybe one time if they are lucky, and only plain rice, because those were the NGOs. They were giving it, and it's a big area. So the problem is lots of people have arrived there in such a small amount of time. So
So they just didn't have the provision.
They didn't have, exactly.
So what could you do? I mean, what could you treat? Were there medications? I mean, what were you doing day to day?
There wasn't any proper medication. Like people with asthma, like who have trouble with breathing, with pneumonia, we did not have proper strong antibiotics. We did not have an inhaler to treat asthma people.
You must have felt so helpless.
So yeah, really, it was overwhelming for me to see because those people were suffering in so many different ways.
Yeah.
We saw lots of people with vague complaints like lack of appetite. Those were all signs of depression because those were somatic complaints. There was no obvious reason.
I see.
So it was quite overwhelming. And
did you leave there feeling like you had been able to make the impact you had set out to make?
Honestly speaking, it was quite overwhelming, but those people, those horrible stories, they moved me. So after that, I decided how we can help.
Okay.
So what we started, I talked with my friends, we collected funds, and we are hiring local doctors from Bangladesh, and we are buying medication. So we are sort of sponsoring medical camps. And also, I made my own NGO, is Humanity Auxilium. I just registered it. I thought that, all the doctors, healthcare professionals, nurses, all the humanitarian people who want to go with me and work for them, I think it's a good start, the Rohingya for this organization to start.
That's terrific.
Thank you.
Are you planning to go back anytime soon?
Yes, I'm planning to go back in May because we have started the field hospital there. I think Malaysia has started it, so we have to see, because back then when I went there, the people who need emergent surgery, they were dying. There were women dying in the tents because, so in tents, but they are living in, as you said, literally hell. It's in garbage condition. So they're literally those plastic sheets and bamboo tents, and with the monsoon season, they're gonna swept away. So the flooding and the mudslides are waiting to happen.
This monsoon season starts in spring.
Yeah, so it's going to start in the next couple of months. And Bangladesh is the wettest country on earth. When it rains for months. So those temporary shelters that they have made, those plastic sheets, they are not going to hold 60 to 80 inches of rain.
They need more permanent shelters. They need places to be resettled.
That's right.
I imagine as a doctor, you're not thinking so much about the big picture issues, but did you have a chance to interact enough with the people to understand what they want? I mean, do they want to go back to Myanmar?
You know what? When I talk to them, I think Rohingya people have amazed me with their resilience. They have suffered through a lot. I have not seen a single family who has their whole family there. Almost all the people that I've met, hundreds of people, they have lost their children or their husbands.
Everyone has lost something.
Everyone lost something.
Yeah.
So when I ask them if they want to go back, yes, they want to go back. It's their ancestral homeland, right? But they want some safety. They want their citizenship back, they want their rights back, and they want some safety from international communities. Because right now, the military government and Aung San Suu Kyi, they are not letting any UN peacekeepers, any journalists to go inside and document the atrocities.
This conference always tackles these big global issues. Why do you think it's so important to have a gathering of, in some cases, really powerful women that attend Women in the World to air these important global issues in a forum like this?
I think it's very important. To be very honest, I was telling Women in the World TV producers and Tina Brown, they amazed me because when I was back in Bangladesh, those refugee camps, I'm a medical doctor. I was struggling hard how I can get access to the media people. I said that, this genocide is going on, so many horrible stories, and world does not know about it. So I think they are doing a great job bringing those people like myself, my stories to be heard, and those hundreds of thousands of people, their stories to be heard. So I think they are doing an amazing job.
What are some of the things that the world still doesn't really understand about the crisis? We've all at this point heard the atrocities that you describe. But what don't people understand about the needs of these people?
I think people, especially world leaders and the UN and all our institutions, they understand the problem very well. But there's a lot of political interest. Lots of these countries, they have their own interest with Burma, so they don't think that it's important. Those hundreds of thousands of people's lives are important, so they don't pay any attention to it. So far, I don't think so any strong enough practical steps have been taken to stop this genocide.
Yeah. When you came back, did you return to your practice, and how did you, I don't know, view your work differently once you had this totally different perspective now on suffering?
You know what, it's very funny. In the first few days, when my patients used to come in, then when they used to tell me about their problems, so there was a laugh or there was a smile on my face, and my patients know me very well. I have a very busy practice in Calgary.
You have a great bedside manner.
Yeah. And they said, Dr. Alvi, you must be thinking about those people that you have seen, in the last few weeks,
yeah.
And our problems is very little, and actually that's so true.
Yeah.
I shared with some of my patients who were worrying about their problems. I said that, your problem is very, very tiny.
Yeah.
Think about those problems.
Yeah.
They have gone through hell. They have nothing.
Yeah.
No food, they have left their house, they have left their country, they have lost their loved ones, and especially the women, not only that they have lost their husbands and children's, they have lost their dignity. So their children have been thrown into the fire, into the river, in front of screaming moms, and it was just horrifying.
Yeah.
So I'm always busy with my patients. I work in 3 clinics and always struggle, finding time to go to my parents-teacher meetings and to my children's, and that my daughter hates it.
How many children do you have?
I have 3. So, and my daughter says that, Mommy, you missed that again, because I always struggle, with my patients. But when I came back there, I said that, someone has to step up. So if the world leaders are so quiet and this genocide is going on, I have to, I don't know, cut down my practice, or what should I say? So that's why I said that, we have to take some practical steps.
It's amazing that you're the mother of 3 children, that you work at 2 clinics in Calgary, and that you're finding time to build infrastructure, health infrastructure in refugee camps. How do you balance that, and what really drives you to do all of that?
It's not easy. As I said, that I was overwhelmed to see such trauma, such horrible stories. But especially one girl I met, she was the same age as my daughter. And when she was crying, I still remember her face and her tears, and still haunts me.
How old was she?
She was 12. So my daughter is 12. When I looked at her, I said that, what's going to happen to her? What's going to happen to those orphan children? So for some reason, her tears have become my driving force. So when I was coming here to New York, I never thought, I'm not a public speaker, I'm just busy mom, busy doctor. When I was coming here, my daughter said, Mommy, you're again going for Rohingya. So I told her that, I'm going for all those orphan kids, they don't have any parents. So I think it keeps us motivated.
Yeah. I imagine that your children understand Mommy is going to help people. How do you pass that spirit on to your children and to other people? I feel like we live in a pretty selfish society now. It's me first, my family first. I think it takes a really special spirit to see outside of oneself.
First of all,
How do you spread that?
I think first of all to become a role model for our children. And the other thing, to get ourselves out of that bubbles that we are living in.
Yeah.
And I think people like helping out, people are compassionate, they want to help, but we have to get them out of that bubble, and media people, you guys, play an important role. These girls, women in the world, they play an important role,
Yeah.
to kind of get set up the standards that what should we think about humanity. As a doctor, you know, doctors work differently. When I went there, I said that, you know, those people have the same organs, they have the same heart who gets affected when our loved ones are killed.
Yeah.
It can be the most devastating thing for anyone to lose their family, to lose their child.
And we would all feel that the same.
Right?
Yeah.
So then I thought that how come that the world leaders in our community is so quiet, so silent about these?
Dr. Fozia Alvi, I wish we had more time to talk. I'd love to see you on a bigger and bigger stage because you're such an articulate voice for a people that have been forgotten, I think, largely by government and the world. Thank you so much for joining us in the Solutions Studio. It's really a pleasure.
Thanks for having me.